Hi, my name is Gloria.
Hi, my name is Ruth.
Hi, my name is Colleen.
Hi, my name is Katie.
Hello, my name is Ingrid.
Hi, my name is Michaela.
Hi, I'm Katie.
Love a blooper.
And hi, my name is Tara. So today we're going to be talking about trisomy 21, also known as Down syndrome. We're going to have a lot to talk about today. Lots of really interesting stuff. So here to start off the video is Colleen, and she's going to talk about what trisomy 21 is and how it presents.
Trisomy 21 is a genetic disorder. It is characterized as abnormal cell division of chromosome 21 in early fetal development. Typically, a person will be born with 46 chromosomes, 23 from the mother and 23 from the father. A person who presents with trisomy 21 has an extra copy of chromosome 21, resulting in 47 chromosomes. The extra chromosome causes overexpression of the genes, contributing to the abnormal development of the physical features and organ system. Trisomy 21 screening is included in routine prenatal care. In the first trimester, a combination of tests are completed, primarily blood tests that look at proteins and hormone levels. In the second trimester, a quad screen is completed. This looks at alpha-fetoprotein, estriol, HCG, and inhibin A. If you have risk factors or abnormal results from the routine screening, your provider may recommend further testing such as a chorionic villus sampling or an amniocentesis that can confirm diagnosis of trisomy 21. After birth, diagnosis is based mostly on physical appearance.
And here is Michaela, and she's going to talk about the management of trisomy 1, the management of trisomy 1, and its prognosis.
Trisomy 21 puts individuals at high risk for a variety of organ complications, which can make their care very tricky, with the most common being congenital heart defects, GI complications like blockages, obesity, blood disorders, and a lowered immune system that increases their risk for developing leukemia and other hematologic cancers. All individuals diagnosed with Down syndrome experience some form of mild to moderate cognitive impairment or intellectual disability, and delayed growth and development. Due to the complexity of a trisomy 21 diagnosis, health management for this population must be handled by a strong and diverse multidisciplinary team. Their multi-organ system complications require care from a number of different specialists. It's important to focus on the prevention and management of complications through routine medical care and close follow-ups, all with the goal of promoting and helping them achieve healthy lifestyles. As Down syndrome involves intellectual disability and overall slower cognitive development, most of the support and education around the diagnosis and management is directed towards the family and the caregivers. Some of the supportive measures provided to families are support groups that can be really beneficial outlets in communities, as over 40% of people with Down syndrome have a family member who stopped working to provide one-to-one care and support to that individual. There's also early childhood intervention programs to assist children with trisomy 21 in their motor, language, social, self-care skill development. And as they get older, special education options are provided for encouraging and supporting their academic development. Combined, these management resources encourage health and independence for individuals with trisomy 21. In addition, with the appropriate management and therapeutic treatments of complications associated with trisomy 21, there's been a drastic increase in the infant survival rates and has actually over doubled the life expectancy of people diagnosed with trisomy 21, from a 25-year lifespan to now 60 years or older.
Now Ingrid is going to talk about the treatment regimen for people with trisomy 21.
So now we're going to talk about the treatment regimen for trisomy 21. Unfortunately, there's no cure for the disease, and there's no specific medication a person can take to treat the disease. However, there's a variety of therapy as well as self-care and early intervention programs that can help a patient improve their quality of life. Treatment are specific to individual needs, and medication are taken to treat comorbidities and secondary illnesses that are developed. Many people with Down syndrome have other comorbidities, so they will need treatment they will need medication to treat those specific symptoms and manifestations develop along the way. For instance, a patient might be taking diuretics and digoxin to treat congestive heart failure secondary to congenital heart defect associated with trisomy 21. So in terms of therapy regimen, physical therapy would help patients with Down syndrome develop their motor skills, muscle strength, improve postures and balance. And in early life, that would be probably like helping a child to learn how to crawl and even walk. Speech therapy, on the other hand, will help a patient with Down syndrome improve their communication skills, given that children with this disease find it difficult to communicate. They have a speech and language delay. Occupational therapists, on the other hand, would help find ways to complete daily tasks for children with Down syndrome. And this will be like teaching self-care skills such as dressing, getting dressed, eating, and even writing, And lastly, we have emotional therapy, which is very important to introduce into early life, because children with Down syndrome might often feel frustrated due to difficulty communicating, performing daily tasks, and those day-to-day challenges that they face. So the emotional therapist will be able to help them find like coping skills and interpersonal skills, which will allow them therefore to reach their full potential. And
here's Gloria to talk about the social determinants of health.
So let's talk more about situations that contribute to the complexity of caring for an individual with trisomy 21. Social determinants of health are the economic and social conditions that influence an individual's health status. In individuals with trisomy 21, the social determinants of health that stick out the most are education access and quality, social and community context, and healthcare access and quality. Let's start with education access and quality. People with high levels of education are more likely to lead longer, healthier lives than those who lack adequate education. It's also important to note that while quality education is important, children with disabilities are more likely to struggle with math and reading. Most children with Down syndrome struggle with basic number skills, and their reading level can sometimes be up to 2 years behind where they're supposed to be. Taking all of this into consideration, it's crucial that children with Down syndrome not only have access to education, but that the schools and institutions providing this education have the adequate resources to serve them. When it comes to social and community context, it's extremely evident that people's relationships with those around them can have a huge impact on their overall health and well-being. Having positive relationships at home, school, and work, as well as within your community, can significantly reduce impacts on health and safety. Most children and adults with Down syndrome continue to develop good social skills and appropriate social behavior as they age, but it's always nice to spend time with people that are going through the same things as you. Organizations like the Special Olympics provide a sense of community and a fun, welcoming social setting for those diagnosed with trisomy 21, as well as for their close friends and family. Finally, it's so important that people with Down syndrome receive access to timely, high-quality healthcare services. Comorbidities add an extra element of complexity to the treatment regimen for trisomy 21. Almost 50% of babies born with trisomy 21 have congenital heart disease. This condition can lead to high pulmonary pressure and the inability of the heart to effectively pump blood. Some heart defects are minor and can be treated with medication, but others may require extensive surgery. So it's important that families of children with Down syndrome have access to the high-quality healthcare that they need. Up to 75% of children with trisomy 21 have some sort of hearing loss. It's recommended that babies be screened regularly for hearing loss and vision problems. Many children with Down syndrome are also prone to ear infections, as their immune system can make it difficult for their body to fight off infections. People with trisomy 21 can also have cataracts or other eye problems that can be corrected with glasses, surgery, or medication. While minor infections may not seem like a big deal to someone without trisomy 21, it's crucial that caregivers monitor children with this condition closely, ensure all immunizations are up to date, and protect the child from being exposed to harmful germs or toxins in the environment that may exacerbate an infection caused by an already weakened immune system. All of these factors need to be taken into account when we think about how complex it truly is to care with an individual with a trisomy 21 diagnosis.
And here's Ruth to talk about family and cultural beliefs and other things of the sort that affect how a person with trisomy 1 is raised and treated.
I'll be discussing how family dynamics, compassion fatigue, and cultural beliefs and attitudes can contribute to the complexity of caring for individuals living with Down syndrome. In a survey conducted by the American Journal of Genetics, most parents of children with Down syndrome reported having a more positive attitude in life because of their child, and 90% of the siblings felt they were better individuals because they had a sibling with Down syndrome. While these reports have a positive outcome, caring for individuals living with Down syndrome can often be challenging for the caregivers, as we would expect. An escalating number of mothers who discover through prenatal screenings that their child will be born with Down syndrome are turning to abortion to terminate their pregnancy and to escape the perceived burden of raising a child with Down syndrome. These prenatal diagnoses have brought up various legal and ethical concerns, indicating that intellectual disabilities are not valid reasons to terminate a pregnancy. In addition, those who bring up these arguments suggest that mothers should be provided with the right resources to assist with caring for their children. Whether a mother chooses to terminate or keep their pregnancy, often parents have expressed that their main concern is how the diagnosis is given by the healthcare professionals. Parents who are concerned that there is a lack of compassion or lack of enough information provided to them. Rather, the emphasis is always on the expected hardships for families that they might face when caring for children with Down syndrome. Parents noted that rarely is Down syndrome portrayed with any positivity as they would hope. Hence, improved communication between parents, family, community, and the health system can increase the satisfaction and the well-being of children with Down syndrome and their parents. Cultural norms and beliefs can contribute to how people perceive and react to individuals living with Down syndrome. For example, most individuals believe that Down syndrome is a serious medical problem that requires its patients to receive differential treatment. Others still believe that people living with Down syndrome are just different from others, but still normal as everybody else in the world. Many people still don't understand the causes and effects of Down syndrome, which is the main source of discrimination. Because these individuals have genetic defect, they are often heavily discriminated against in social and educational settings. Some are even sent to institutions or segregated from mainstream schools because of their genetic defects. As noted, being given a diagnosis of Down syndrome can be challenging for the individuals and their caregivers. Medical professionals have a huge role to play in ensuring that families have the right resources and support provided to them, which can often lead to a sense of comfort for these families. Thank you.
Katie M. is going to talk about how Trisomy 21 affects functionality.
So let's talk about how Trisomy 21 affects functionality.
So Trisomy 21 does cause some medical changes that can affect cognitive and physical function, but it is important to remember that each person is different and early intervention is key to maintaining function in daily living. One of the biggest effects on functionality is the hypertonia caused by Trisomy 21. This makes their joints extremely flexible and causes increased energy requirements, lower strength, and increased risk for injury due to gait instability. This means that gross and fine motor skill development milestones are reached a bit later than in children without it. There are also learning disabilities that come with Trisomy 21. Children with Trisomy 21 require more time to learn concepts, which can affect their social and occupational lives. In general, the way Trisomy 21 affects cognitive and physical functionality just means that children with Trisomy 21 tend to hit their developmental milestones and pick up developmental skills a bit later. It is important to note, though, that they do hit them all.
That's helpful to know when evaluating pediatric patients with Trisomy 21. Are there any alterations in growth we expect to see with Trisomy 21?
Yes, children with Trisomy 21 are at a much higher risk for low birth weight and congenital heart defects. This means that patients will likely grow physically slower than children without it, and they might not hit the same growth chart goals. So there are actually modified growth charts for these children, and they will also often hit puberty later as well.
So it sounds like as healthcare workers, we should be aware that children with Trisomy 21 are likely to hit growth and developmental markers at a different pace than children without. But what about older adults?
Thank you for bringing that up. Just like the rest of the population is living to older ages, people with Trisomy 21 are as well. And it's actually brought up some new areas for research, as normal aging in adults with Trisomy 21 is not well understood. However, we do know they experience accelerated aging and have some specific alterations in their aging. They are at a higher risk for sensory loss, and this can often be mistaken as stubbornness, so it's important to get frequent sensory evaluations. They are at also higher risk for hypothyroidism, obstructive sleep apnea,
arthritis, osteoporosis, celiac disease, and early onset Alzheimer's as they age. Also, fall risks become critical in older adults with trisomy 21 because they're at a much higher risk for atlantoaxial instability and cervical spine concerns. They require a more extensive interdisciplinary team than their counterparts.
I see. It sounds like they're at a high risk for polypharmacy and polymedicine.
Oh, definitely. It's really important for them to have good communication between all members of their care team.
Do people with trisomy 21 experience any alterations in lifestyle changes?
Yes and no. Most people with trisomy 21 work and have careers, so as they get older, they look into retirement too. They also experience the transition most older adults do from a work-centered lifestyle to one more focused on recreational activities and maintaining social connections. One big difference, though, can be their living situation.
What do you mean?
Not every person with trisomy 21 requires a caregiver, but for those that do, by the time they reach older age, their parents are likely in a stage of life where they're experiencing significant illness, disease, incapacitation, or even death. Older adults with trisomy 21 will likely have to transition to home health care or group homes earlier than their counterparts because of this.
Maya is going to introduce us to the wonderful world of early intervention programming.
So let's talk about some more early intervention programs.
Yeah, sure. So early intervention programs are designed for kids with Down syndrome or other disabilities to help them reach specific key milestones such as gross and fine motor abilities, language skills, social development, and self-help skills. It's a very systematic approach that involves therapy, exercises, and activities designed to target the developmental gap children with Down syndrome may experience.
So who's eligible for early intervention?
Actually, these services are mandated under federal law called the IDEA, or Individuals with Disability Act. Generally, early intervention programs accept infants from birth until 3 years old, but some children may even be eligible until kindergarten. In Illinois, families with an eligible infant or toddler are only eligible until 3 years old. You can use the Department of Health Services office locator to find an early intervention child and family connections offices near you.
Thank you so much for that resource.
No problem. I'm glad you asked about it. Early intervention is a great resource for families, their children, and caregivers alike. Parents and caregivers can gain support, encouragement, and loads of information. It allows parents the space to learn how to meet their children's specific needs and further encourage their child's development.
That's great. What are some of the developmental milestones that should be reached with these programs?
For example, in neurotypical children, infants typically crawl around 6 to 12 months, and in children with Down syndrome, that range increases to 8 to 22 months. Typically, children can self-spoon around 12 to 20 months, and in children with Down syndrome, that range is 13 to 39 months. Also, children typically have bowel control around 16 to 42 months, and they make children with Down syndrome 2 to 7 years.
Oh wow, there are some clear distinctions. I understand why parents may experience caregiver role strain. Who else can help support the parents or caregivers?
In the U.S., there are 4 national Down syndrome organizations. There is the Global Down Syndrome Foundation, National Down Syndrome Congress, National Down Syndrome Society, and Down Syndrome Affiliates in Action. Each of these organizations provide supportive resources to families with children with Down syndrome.
What are some examples of these resources they provide?
It could be inclusive education, a guide for new parents, information on Down syndrome and other neurocognitive disorders, behavioral challenges, caregiving newsletters, friends and social relationships, healthcare guidelines, and so much more.
This is great information to have. I'm so glad it's easily available and accessible. What else would someone with Down syndrome need?
Well, as we talked about, children with Down syndrome typically learn and develop at a slower rate than peers, so it's important that classroom accommodations are set in place to adequately support the learning abilities of students with Down syndrome. Teaching strategies may even look different depending on the individual needs of the student.
What do you mean by that?
It means that additional teaching interventions are important to ensure students are learning at an appropriate pace. For example, visual learners may need pictures and spoken word, demonstrations, modeling, visual cues, kinetic reinforcement, color coding, or highlighting. If someone has a weak auditory processing, then it's important to always allow them adequate response time.
I never thought about these techniques. What else could be done?
Well, if someone has a weakened short-term memory, it can be helpful to break down directions into even smaller steps and using repetition. You also might have the literal learner with whom you should avoid using slang and homonyms or words that sound alike but have different meanings.
Okay, thank you so much. It all makes sense. It was a great breakdown.
No problem.
KDE is going to talk about the financial consideration when it comes to care for people with trisomy 21. And then she's going to introduce us to a friend of hers, which I'm pretty excited about.
A 2017 study comparing individuals with Down syndrome and individuals without chromosomal abnormalities compared inpatient, outpatient, emergency room, home health agency, and other medical costs. The study found that caregivers with children with Down syndrome paid an average of $18,248 more in out-of-pocket medical expenses compared to caregivers of children without Down syndrome from the ages of birth to 18 years old. One study found that in the first year of life, children with Down syndrome and severe congenital heart disease had 11 times higher hospital costs in the first year of life. While hospital costs and length of stay were longer for children with Down syndrome and severe congenital heart disease, inpatient costs decreased with age from birth to 8 years old. Individuals might want to talk to a genetic counselor before diagnostic testing to go over family history, the benefits and risks of testing, and the specific patient situation. Specifically for children with congenital heart disease, follow-up with a cardiologist throughout the lifespan is important. Obstructive sleep apnea can also be present, so a sleep study at a pediatric sleep center by 4 years of age is recommended. In addition to the normal immunization schedule, children with Down syndrome should receive the RSV vaccine if born premature or have an unrepaired congenital heart disease, and the pneumovax vaccine if they have a chronic cardiac or respiratory problem. Hypothyroidism is also common among individuals with Down syndrome, so annual thyroid function tests are recommended. As a young adult and into adulthood, it is important to determine what living situation makes the most sense for the individual with Down syndrome, as well as the family, while also considering the cost. Individuals with Down syndrome may be capable of living independently, while other options include living with a supportive roommate that can assist with tasks and planning, living in a group home which consists of multiple individuals with a disability living together with qualified care staff, long-term care for individuals that need 24-hour care, or living in the family home with family. Finding a job that fits with the individual might also be a consideration. Moving into older adulthood, individuals with Down syndrome have a much higher risk of developing dementia and Alzheimer's and develop signs of aging earlier and faster than healthy individuals without Down syndrome. It is recommended that they are screened for Alzheimer's beginning at age 40. Down syndrome is no longer a childhood disease. It affects the whole lifespan, which shows the importance of understanding how it can impact individuals throughout the stages of life. This is a picture of me and my friend Kari, who I met through a program called College Buddies that paired college students with community members with intellectual and developmental disabilities. I spent time with Kari walking, baking, playing board games, and other activities, and have since kept in touch with her. Kari is 42 years old and she lives at home with her parents. She has a loving family, including 2 sisters and 6 nieces and nephews that she loves to spend time with. Kari has a part-time job working in the dining hall at a local college and takes public transportation to and from her job. Like many individuals with Down syndrome, Kari has a history of heart problems, including open heart surgery at the age of 4, arrhythmias requiring an implantable cardioverter defibrillator, and most recently, she received a new pulmonary valve in 2021. She was not a candidate for open heart surgery, but she was able to receive this new valve through a catheter through her groin. The valve she received is usually put in children, but she was the first adult to be able to receive this valve. Since receiving the new valve, she has been feeling great.
As nurses, there is much that we can do to support individuals and their families with trisomy 21, from helping them manage their medical complications to helping them thrive in life. When a family first finds out that they are expecting or even have just given birth to a baby with Down syndrome, there will be a lot of emotions to process and a lot of choices to make. We can provide comfort and resources. We can help manage their care. We can debunk any myths about Down syndrome as being a disease. Honestly, the opportunities for us as nurses are endless. Evidence shows that therapeutic conversation has a tremendous effect on bolstering how well a family adapts after receiving a trisomy 21 diagnosis. Therapeutic conversations are essential in planning our care for patients with trisomy 21. They are purposeful, they are time-specific, they are used to assess and highlight the strengths of the family. It also allows for the family to feel listened to and understood. It also works to improve communication between family members. Families that thrive will look positively at the efforts that they have made to create a happy and healthy life for their child. And people with trisomy 21 thrive when they can lean on their strengths and live their lives to their full potential. As nurses, we are well equipped to help these patients and families achieve these goals. And that's our presentation on trisomy 21. Thanks so much for listening. Till next time. Bye.